Okay. Good morning, my dear friends. Stamped Azura എന്ന പേരിൽ നടത്തുന്ന റിവിഷൻ ക്ലാസിന്റെ കണ്ടിന്യൂഷനിലാണ് നമ്മൾ നിലകൊള്ളുന്നത്. കഴിഞ്ഞ ദിവസങ്ങളിൽ തേർഡ് ഇയറിന്റെയും സെക്കൻഡ് ഇയറിന്റെയും ചില ടോപ്പിക്കുകളൊക്കെ നമുക്ക് റിവിഷൻ ക്ലാസ്സുകൾ കിട്ടുകയുണ്ടായി. പ്രഗത്ഭരായ അധ്യാപകരുടെ അല്ലെങ്കിൽ കഴിവുള്ള ഈ മേഖലയിൽ അതാത് സബ്ജക്റ്റിലെ ഏറ്റവും കൂടുതൽ കഴിവുള്ള ടീച്ചേഴ്സിന്റെ മികവാർന്ന ക്ലാസ്സുകളാണ് കഴിഞ്ഞ ദിവസങ്ങളിൽ നമുക്ക് കിട്ടിയത്. അതുപോലെ ഇത് എല്ലാവർക്കും വളരെയധികം ഉപകാരപ്രദമായി എന്നറിഞ്ഞതിൽ വലിയ സന്തോഷമുണ്ട്. നമ്മളെല്ലാവരും എടുക്കുന്ന എഫേർട്ടിന്റെ ഫലമാണ് ഇതിലൂടെ അറിയുന്നത്. അതുപോലെ തന്നെ ഇന്ന് നമ്മൾ റിവിഷൻ ക്ലാസ് സംഘടിപ്പിക്കുന്നത് സെക്കൻഡ് ഇയർ ഹെമറ്റോളജി. നമുക്ക് വേണ്ടി ക്ലാസ് എടുക്കാൻ തയ്യാറായിരിക്കുന്നത് ജിപ്മർ യൂണിവേഴ്സിറ്റിയിൽ MSc MLT മെത്തഡോളജി കംപ്ലീറ്റ് ചെയ്ത് PhD ചെയ്തുകൊണ്ടിരിക്കുന്ന ശ്രീരാഗ് സാറാണ്. സാറ് വളരെ മികവാർന്ന രീതിയിൽ നമുക്ക് എല്ലാവർക്കും മനസ്സിലാവുന്ന രീതിയിൽ ഹെമറ്റോളജി സെക്കൻഡ് ഇയർ ടോപ്പിക്ക് റിവിഷൻ മോഡൽ ക്ലാസ് എടുത്തു തരുന്നതായിരിക്കും. എല്ലാവരും ഇതിനെ നല്ല രീതിയിൽ ഉപയോഗപ്പെടുത്തി നല്ല വിജയങ്ങൾ കൈവരിക്കാൻ ഇതൊക്കെ നമുക്കൊരു നല്ല മുതൽക്കൂട്ടാവട്ടെ എന്ന് മാത്രം ഒരിക്കൽ കൂടി എല്ലാ വിദ്യാർത്ഥി സുഹൃത്തുക്കൾക്കും വിജയാശംസകളും നേരുന്നുണ്ട്. ക്ലാസ് എടുക്കാൻ വേണ്ടി ശ്രീരാഗ് സാറിനെ നിങ്ങൾക്ക് ഏവർക്കും ക്ഷണിച്ചോളൂ.
താങ്ക് യു നവാസ്. വാം ഗുഡ് മോർണിംഗ് ടു ഓൾ. നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാൻ തോന്നുന്നുണ്ടല്ലേ? സമയം ഒരു നവാസ് വെയിറ്റ് ചെയ്യണോ? ഇനി വേണ്ടല്ലോ. Okay. Anyway, I will be sharing my screen. നവാസ് കാണുന്നുണ്ടോ? സ്ക്രീൻ കാണുന്നുണ്ടോ? കാണുന്നില്ലേ? ഓക്കെ. താങ്ക് യു.
ഹലോ
ഹലോ.
സ്റ്റാർട്ട് ചെയ്യാലോ? ഓഡിബിൾ ആവുന്നില്ല.
ഓഡിബിൾ അല്ലായിരുന്നു. ഓക്കെ. So this is your topic. Like syllabus is the whole in that syllabus the whole topic is like hematology 2 and clinical pathology. So today I'm dealing with hematology 2 only. It's a 60-hour syllabus. So we are just making it into a 60 minutes topic. Like 60 minutes we are just trying to cover all the topics. ഇതില് ഈ മെയിൻ പോയിന്റ്സ് മാത്രമാക്കിയിട്ട് ഞാൻ മെയിൻ പോയിന്റ്സ് മാത്രമാണ് ഡിസ്കസ് ചെയ്യാൻ ഉദ്ദേശിക്കുന്നത്. പ്ലസ് ഇതില് ഈ 60 minutes first we will discuss about the main points. Secondly, we will be discussing the possible questions from that points. And thirdly, how to write on an essay if ask an essay from a particular point, how to attend that. And the final, if you have any doubts, we will clear it. So this is the syllabus. Anyway, you know that. So the first one is the morphology of red cells in health and disease. So the major points you need to know is what is anisocytosis. Anisocytosis is nothing but it's a variation in size. See, anisocytosis. So there are two types, macrocytes and microcytes. So you should know what is macrocyte and what is microcyte and what is normocyte as well. Then we need to go to the next one is the poikilocytosis. Poikilocytosis is the variation in shape. So the variation in shapes there are so many variation in shapes are there. Like the major or the main ones are spherocytes, which are seen in hereditary spherocytosis. Sorry, there is a spelling mistake is there. So the elliptocytes and the ovalocytes, which are most commonly seen in hereditary elliptocytosis. Schistocytes are the, we can say, a kind of marker for hemolytic anemia. Then the keratocytes, helmet cells, bite cells, they are also called as horn cells that are seen in hemolytic anemia, like especially in G6PD deficiency anemias. And the acanthocytes, which are kind of spine shape, and echinocytes or sea urchin or hedgehog things. These things will be mostly seen in hemolytic anemia. And leptocytes will be there. Leptocytes are RBCs which are having a rim of cytoplasm. So actually, it will take the pink color only in a rim. And the target cells that are carom coin shaped cells that are seen in sickle cell anemia, it is seen, but though it is predominant in thalassemia. And stomatocytes that are seen in hereditary stomatocytosis, and the sickle cell that is seen in the sickle cell anemia. And the next one is the erythrocyte inclusions. The major erythrocyte inclusions are Howell-Jolly bodies, Pappenheimer bodies, and Cabot rings, and all those things will also be there. So these are the main things in the first point. So the possible questions from these aspects are mainly what is anisocytosis, what is poikilocytosis. Maybe they could ask some particular cells like target cells or sickle cells, kind of things. Then the inclusions like Howell-Jolly bodies, Pappenheimer bodies, and the Cabot rings also can be asked for. Mostly it will be a 3-mark question, or if you are more lucky, you will get it for 5 marks. Then the second one is the systematic method of examination of blood film and reporting. So what are the basic things you need to know? You have already finished the first part in the first year, like you have already learned how to stain, how to make a smear, and all those things. And you know what is the ideal, the criteria for an ideal smear, all those things you know. But here, you need that backup, that is different types of blood films that are thick and thin, staining methods, mainly the Romanowski staining, like most importantly Leishman stain and Giemsa. Then the criteria for an ideal smear. Then the cytology of blood smear. What are the normals and what are the abnormal cells in the smear? Then the PS reporting pattern, which includes first you should start from the RBC, then the WBC, then platelet, then parasites. So if parasites are present, you can mention that. RBCs can be reported as normocytic normochromic, or if it is microcytic hyperchromic, or maybe macrocytic normochromic. Usually we won't say that hyperchromia in this thing, RBCs. And in case of WBCs, the predominance of cells you can mention, or the distribution also you can tell. If there is any shift to left or blast or any other abnormal forms, that also you can mention in the thing. And the platelet adequacy and distribution is a must. Then the parasites, if parasites are present, you can mention what are the blood parasites, that is anyway you have in another part also they are discussing. Then next one is, okay, the questions, probable questions from this is maybe an essay can come, like I think it has already asked in one of the previous question paper. I saw that one question regarding this, the ideal smear, and maybe a combined question can become like, what is an ideal smear, thin smear, and how to prepare a thick smear or thin smear, plus the parasitic part or the PS pattern itself could have come. Then anemia. Anemia, the basic thing you need to know is an definition. You must know any of the definition. There are two, three definitions are there. One is the reduced oxygen carrying capacity of red cells, or you can define it based on the HB or BC, PCB values, whatever. But you should write one of the definition in the even if they ask just an anemia, just define it, then go for your answer. So and the next thing is the classification. Classification is there are two kinds of classification. One is the etiological classification, and another one is the morphological classification. Morphological classification is very easy, uh, and people may forget to write that classification also. Then the laboratory diagnosis, hemoglobinopathies and Ham's test are the main points in the anemia, which is discussed in the syllabus. So we will be going through one by one. First one is the classification of anemia, which can be broadly classified into morphologically or etiologically. The morphological classification of microcytic anemia, first one, microcytic anemia, the example is iron deficiency anemia, sideroblastic anemia, etc. Then a normocytic anemia. Normocytic anemia, the example is sickle cell anemia is a normocytic anemia. Then the macrocytic anemia, where the RBC is having size more than the normal. So the megaloblastic anemia and macrocytic is an example, and the pernicious anemia is another example for macrocytic anemia. Though pernicious anemia is a non-megaloblastic macrocytic anemia. Then the etiological classification, it is mainly divided into due to impaired cell production and due to increased red cell destruction. So the impaired red cell production is based on the nutritional deficiency. The nutritional deficiency may be due to iron deficiency, that is iron deficiency anemia, vitamin B12 or folate deficiency, that is megaloblastic anemia, and the vitamin C deficiency can also cause anemia. Then second one is the stem cell or the erythroid precursor defect, which can lead to aplastic anemia, pure red cell aplasia. Then the third one is the miscellaneous things, that is anemia due to chronic disease or marrow suppression due to drugs, that can also cause impaired red cell production and finally lead to anemia. Then the next half is due to the etiology classification. The second thing is it is due to increased red cell destruction. Actually, this is the classification of hemolytic anemia as such. So it has two arms. One is the intercorpuscular defect. Intercorpuscular defect in the sense it is the problem in the red cell itself, and the extracorpuscular defect, it is due to the surroundings. It is actually, the problem is not with the RBCs, it is with its environment. Okay, so intercorpuscular defects can be divided into two. One is the hereditary and the acquired. Hereditary intercorpuscular defects can be classified into enzyme defects, which is the main one is the G6PD deficiency and the G6PD deficiency. Then the membrane defect is the second one, that is hereditary leads to hereditary xeocytosis or elliptocytosis or stomatocytosis, all those things. Then the third one, globinopathies, that are thalassemia, sickle cell disease, HBD, HBE, all those things will come in hemoglobinopathies. Then the acquired one are PNH, paroxysmal nocturnal hemoglobinuria. Second one is the extracorpuscular defects. It's immune hemolytic anemia, fragmentation syndrome, and hypersplenism. So, ഇത്രയാണ് ആക്ച്വലി മെയിൻ ക്ലാസിഫിക്കേഷൻ ഓഫ് അനീമിയ എന്ന് പറയുന്നത്. സോ you need to know the definition and classification. Why? Because most of the previous question papers asked for these two. മെയിൻ ആയിട്ട് എല്ലാ ക്വസ്റ്റ്യൻ പേപ്പറിലും 2012 ഓൺവേർഡ്സ്, അതായത് യൂണിവേഴ്സിറ്റിന്റെ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ പേപ്പർ ഓൺവേർഡ്സ്, ലാസ്റ്റ് ഇയറിൽ കഴിഞ്ഞ 2019 കഴിഞ്ഞ ക്വസ്റ്റ്യൻ പേപ്പറിൽ വരെയും ഏത് അനീമിയ ക്വസ്റ്റ്യൻ ചോദിച്ചു കഴിഞ്ഞാലും എസ് എ ചോദിച്ചു കഴിഞ്ഞാലും അതിൽ 1 mark ക്വസ്റ്റ്യൻ ഈസ് ഫോർ ഡെഫിനിഷൻ, then 3 to 4 mark question may be for mostly for the classification. So ഇത്രയും പഠിച്ചു കഴിഞ്ഞാൽ തന്നെ നിങ്ങൾക്കൊരു 5 marks എസ്ഐയിൽ തന്നെ സ്കോർ ചെയ്യാൻ വേണ്ടി പറ്റും. ക്ലാസിഫിക്കേഷൻ ഡെഫിനേഷനും പ്രോപ്പറായി എഴുതി കഴിഞ്ഞാൽ 5 മാർക്കും തരാതിരിക്കാനുള്ള കാരണങ്ങളൊന്നും ഇല്ല എന്നാണ് തോന്നുന്നത്. Then the diagnosis. So broadly diagnosisൽ ഫസ്റ്റ് ഒരു അനീമിയയിൽ HB, RBC, PCV എപ്പോഴും റെഡ്യൂസ്ഡ് ആയിരിക്കും. ദെൻ അതർ ഇൻഡീസസ് MCV, MCH, MCHC. MCV, MCH, MCHC മൈക്രോ ഹൈപ്പോയിൽ എപ്പോഴും റെഡ്യൂസ്ഡ് ആയിരിക്കും. പക്ഷേ ഒരു മാക്രോസൈറ്റിക് അനീമിയയിൽ അല്ലെങ്കിൽ നോമോസൈറ്റിക് അനീമിയയിലാണെങ്കിൽ അത് എയ്തർ നോർമൽ ആയിരിക്കും അല്ലെങ്കിൽ സ്ലൈറ്റ്ലി റെഡ്യൂസ്ഡ് ആയിരിക്കും. പക്ഷേ മാക്രോസൈറ്റിക് അനീമിയയിലാണെങ്കിൽ increased ആയിരിക്കും. Okay, so then in a diagnosis you need to mention the HB and RBC PCV status, red cell indices status, and the possible anisocytosis. If it is iron deficiency anemia, you should mention what all the things seen in that, those things. And you're going to iron deficiency anemia. The main anemia that would have asked for exam are iron deficiency anemia, sickle cell anemia, hereditary spherocytosis can be asked, or a hemolytic anemia as such you can ask, hemoglobinopathies, etc. can be asked. So the first one is iron deficiency anemia. Blood parameters and morphology has to be right. So blood parameters are HB, RBC, PCV will be reduced, and the indices will also be reduced. Morphology, it is a microcytic hypochromic anemia. Then the leptocytes may be seen in severe iron deficiency anemia. Then the bone marrow cytology, what are the cells in the bone marrow will be seen. Then marrow iron stores, Perl staining is one of the main stain we are using for the identification or the demonstration of iron stores. So Perl staining is another question from this side. Even for 5 marks or 3 marks, it can be asked. Then the marrow iron stores will be depleted or reduced in case of iron deficiency anemia. Then the iron status, this is actually from the serum thing or the biochemical part. This can be written for if it is asked for a 5 mark question, and the other tests also can be written. And you can write one more thing additionally, like differential diagnosis. How will you diagnose or how will you differentiate it from sideroblastic anemia? Is a microhypoanemia where there is also iron is the main problem, iron deficiency. Though it is not due to the iron deficiency, it is because of the iron is there in the body, but it is the precursor cells are not able to take it up for the hemoglobin synthesis. So in sideroblastic anemia, bone marrow iron stores are increased, that we can see with the Perl staining, and ring sideroblasts also seen in the RBCs or in the peripheral blood smear. And the thalassemia minor, which is having actually this is also a microhypoanemia where RBCs will be more than 5 million. In iron deficiency anemia, it will be always reduced less than 5 million with microhypo, and HbA2 is increased more than 3.5%, and the RDW is also one of the other parameter. Then the another important one is the megaloblastic anemia. among the nutritional deficiency anemia. So blood parameters and morphology, in that macrocytes you need to mention. Bone marrow cytology, in that megaloblast must be mentioned, and shilling test may be asked. B12 levels, folate levels, Fig loop can be mentioned in the answer sheets. Then the hemolytic anemia, bone marrow part, it is the erythroid hyperplasia will be there with normoplastic reaction, and that is the hallmark, so it has to be mentioned. There will be a reverse of ME ratio, myeloid erythroid ratio. Ineffective erythropoiesis, that is, erythropoiesis will be there, but the erythropoiesis there, but the erythropoietic cells, those normoblast or those cells will be taken, and it has gone for apoptosis or something like. It is distracted in the spleen, and the reticulocytosis will be there in blood. And coming to peripheral blood, there is polychromatophilia due to reticulocytosis in peripheral blood. If you are staining it with Leishmanson or any of the Romanowski stain, it will be polychromatophil. It having multiple colors you can see on a single cell. Then the NRBCs will be there more in the hemolytic anemia, and neutrophilia with shift to left also we see. So these are the main points you need to write. So in any diagnosis, you can first start with the peripheral blood. What is the peripheral blood picture? Then what is the bone marrow picture? And the specific test for all those things. So in hereditary spherocytosis, you can add the main. Actually, this is common for most of all the hemolytic anemias. And this thing for hereditary spherocytosis, there is spherocytosis in the or the spherocytes seen in the peripheral blood smear, and OFT is the one of the osmotic fragility test, is one of the main tests we are using for the diagnosis of hereditary spherocytosis. Then next one is hemoglobinopathies. Hemoglobinopathies comprises of a large number of diseases, like not large number in the sense it is the most important diseases. One is sickle cell disease, another one is the thalassemia. So those two can be asked for a 5-mark questions. Then so hemoglobinopathies, we will do a electrophoresis, HPLC. These are two common things. And for the specifically in sickle cell disease, sickle cells is seen in cells in PBS, and sickling test, solubility test, and HbF estimation. The next one is thalassemia, target cells in the peripheral blood smear, HbF estimation. Then the other some tests like globin chain synthesis, mutation studies can be also written in the part. Then there is an in thalassemia. These are the main thing for the thalassemia major, and for thalassemia minor, there is a test called NESTROPH. NESTROPH is a naked eye single tube red cell osmotic fragility test. And the HbA2 estimation. Also, HbA2 will be increased in thalassemia minor. So these points can also be included in that part. So the next one is PNH. It's an acquired hemolytic anemia. Paroxysmal nocturnal hemoglobinuria is an acquired hemolytic anemia, and due to the deficiency, it is due to the deficiency of cell membrane bound proteins such as CD55 or decay accelerating factor, and CD55, 59, membrane inhibitor of reactive lysis. Actually, there is a complement in a complement activation state. Majorly these two angles or these two proteins are protecting our red cells from hemolysis. So if these two are deficient, there is a chance of or the possibility of hemolysis. So this is the principle behind that. So next one is the Harms test. So Harm test is used for the diagnosis of PNH. It's a chance of 3-mark question for as Ham test. Ham test is usually come for 3 marks. Then another one. So we will just go back to the anemia part. So we will just, so this is a, I already discussed, this is a iron deficiency anemia is a 5-mark question and maybe come as an essay clubbed with the definition and classification of anemia. So megaloblastic anemia can also come as a 5-mark question as well as a 3-mark question with the essay question. Also the shilling test, and in iron deficiency anemia, this Perl staining can also come as in 5 marks or 3-mark question. And in megaloblastic anemia, the shilling test can also come as a 3-mark question or 5-mark question. Hemolytic anemia, reticulocytosis can be asked for 5 marks. Then the shift to left, what is shift to left? That is a question can be asked for a 3-mark question. And in hereditary serocytosis, the chances are for mainly serocytes. What are serocytes? That is a question for 3 marks. And OFT can be asked. OFT can be asked for. It is already asked. I think in the previous one of the previous question paper, I saw that question as the principle and the interpretation of osmotic fragility test. Then the hemoglobinopathies, electrophoresis. Hemoglobin electrophoresis can be asked for 5 marks. Then in sickle cell disease, sickle cell anemia itself can be asked for an essay, or the sickle cell disease is it is containing sickle cell anemia, a sickle cell group of disease. That's why it's called as sickle cell disease rather than just sickle cell anemia. Then sickle cell, it can be asked for 3 marks. Then the sickling test can be asked for 3 marks. Solubility test can be asked for 3 marks. And the HbF estimation, main are Clio test and the alkali, that is acid elution test, that can be asked for 3 marks. Then another one is the alkali denaturation test, that can be asked for 3 marks. So these are the main thing. In thalassemia, target cells can be asked. Nestrov, chances are least, but there is a chance of asking for 3 marks. Then in PNH, this PNH can be asked for 3 marks, and the harm test can be asked for 5 marks or 3 marks. So moving on to the infectious mononucleosis, the next topic. So it is caused by an Epstein-Barr virus. So the main points are: it is caused by Epstein-Barr virus. The identification of there will be a heterophil antibody circulating in the serum. It is identified by a Paul Bennell test, and the monospore test is also available with the principle of Paul Bennell test. Immunofluorescent antibody tests are also used. And one important thing is these reactive lymphocytes. Reactive lymphocytes can be seen in the peripheral blood smear. So this infectious mononucleosis can be asked for a 5-mark question or a 3-mark question. Paul Bennell test can also be asked for a 3-mark question, and the reactive lymphocytes can also ask for a 3-mark question. So reactive lymphocytes, these two are the reactive lymphocytes. It has a large nuclei with open chromatin and irregular abundant cytoplasm, and is basophilic at the periphery. So this is the character. So you can, if you are asked for the reactive lymphocytes, then you can write the morphology first, these 2 points, and plus you can write the condition in which they are seen. Usually in most of the viral infections, reactive lymphocytes can be seen. So another main topic is leukemia. Leukemia, the definition is a must. So question starts with the definition most of the times in essay. It is an abnormal proliferation of leucocytes or blast. So leukemia can be broadly divided into two: myeloid neoplasms and lymphoid neoplasms. Myeloid neoplasms are acute myeloid leukemia composed of immature myeloid cells, and myelodysplastic syndrome, that is defective maturation of myeloid cells with small increase in blast. The last one is the myeloproliferative neoplasms, that is overproduction of one or more types of myeloid cells, where the number of blasts will be minimal. The next one is the lymphoid neoplasms, acute lymphoid leukemia, B or T type, chronic lymphoproliferative disorders or CLPD, that is B or T cell type, lymphoma, Hodgkin, and NHL. In this, you only need to focus on the acute leukemia, and in this chronic lymphoproliferative, that is CLL. L and CLL here, and in this, the major one is the AML, and here major one is CML is coming here, and one more thing, the PV, that is polycythemia vera, will also be important. And based on the onset of disease, leukemia can be classified into two: acute leukemias and chronic leukemia. Acute leukemia are having a rapid onset. So acute leukemia, it's an uncontrolled proliferation of blast, more than 20% as per WHO in blood and bone marrow. There are two types: ALL, that is acute lymphoblastic leukemia, and AML, acute myeloid leukemia or acute myeloblastic leukemia. The next classification is important. It is classified based on two criteria. Two classifications are there. One is the FAB classification, the other one is the WHO classification. FAB classification, the French, American, British classification. This is a bit important for the examination point of view because it can be asked for 5 marks. So first you need to write the criteria. There is more than 30% of blast in blood and bone marrow is needed, and it is based on the morphology and cytochemistry of blast. So AML is classified from M0 to M7, ALL is classified from L1 to L3. So this is the FAB classification. Acute myeloid leukemia is class M0 is AML M0 is minimally differentiated leukemia. M1 is myeloblastic leukemia without maturation. M2 is myeloblastic leukemia with maturation. There is 80% of blast will be there. And M3 is promyelocytic leukemia. Then M4 is myelomonocytic leukemia. M5 is monocytic leukemia. M6 is erythroleukemia. M7 is megakaryoblast leukemia. So at least you should know the classification, at least the heading of the classification. What is M0? What is M1? What is M2? What is M3? Till M7. So in this, it is easy to understand. In M0, there is zero differentiation. M1, there is with maturation. Then there is myeloblast leukemia with, there is no differentiation. In M1, there is no maturation. M2, there is maturation. Then M3 onward, it's promyelocytic. It is maturing further. Then myelomonocytic leukemia. Then monocytic leukemia. Then erythroleukemia. It's actually these erythroleukemia is more erythroid blasts will be there more, and the megakaryoblast will be more in megakaryoblast leukemia. Then acute lymphoblastic leukemia, L1, L2, and L3. L1 is a small homogeneous cells with inconspicuous or 1 to 2 nucleoli. Then L2 is the large cells with variable size with 1 to 2 nucleoli. L3 is large cells, homogeneous, finely stippled chromatin with basophilic vacuolated cytoplasm. See, at least you should know this. This can be asked for 5 marks. So if you can write the classification criteria, there is more than 30% of blast, and it is based on the morphology and the cytochemistry. It will give you at least 1 mark I suppose. Then the classification. This has to be written. So from this itself, sometimes any one of these can be asked for an essay. In an essay, in a composite essay, like define leukemia, classify what is FAB classification of leukemias. Then any one of the blood or bone marrow picture of, mostly the bone marrow picture of, or the blood picture of myelomonocytic leukemia is already asked. So any one of these can be asked. And the ALL as well. ALL is also, once it is asked in, I have seen it in one previous question paper, the blood and bone marrow picture in ALL. So what is WHO classification? This can be asked for a 5-mark or a 3-mark question. So basically you need to know the criteria. Here the percentage of blast is 20 or more in blood and bone marrow, and it is based on morphology, clinical features, cytogenetics, and molecular genetics. This is the classification. Actually, at least just try to read these things. It can be asked, not necessarily. So diagnosis of acute leukemia. So in a diagnosis part, you need to write the number of blasts. Actually, number of blasts in the sense you can it can be divided into the later part, like blood and bone marrow. Blood, this much blast, and these are the major cells same. And in morphology also, you can the morphology can be like that, like in a promyelocytic leukemia, you could have seen the orods, and in myelo or monocytic leukemia, you can see a myelocytic. It's a myelocytic leukemia, and monocytic leukemia will be there, and monoblastic leukemia will be there in that. So monocytes and monoblasts you can write. So predominantly there will be a increase in blast cells. So that you should mention in your paper. In cytochemistry, the major stains are myeloperoxidase, Sudan black B, non-specific esterase, periodic acid shift state, and acid phosphatase. And so this can be asked for a 5-mark question, and maybe the myeloperoxidase alone can be asked as for a 3-mark, and Sudan black B can also be asked for 3 marks. Even periodic acid shift stain also can be asked for 3 marks. Then the other things you can just mention the immunophenotyping, mainly flow cytometry, cytogenetics, and molecular genetics. These points can be mentioned. And the extra points, it's not actually extra points. These can be extra points that can be asked for the exams. One is the ORODs. It is seen in acute promyelocytic leukemia. Then the double esterase. Double esterase is a cytochemical stain used in myelomonocytic leukemia. Here we will use 2 esterase stains. One is chloroacetyl esterase, which stains the promyelocyte, and alpha naphthyl acetate esterase, which stain the monocyte. This will be a red color. This will be a brown color. So this can be asked for. Sometimes double esterase can be asked for a 3-mark question. Then the myeloproliferative neoplasms. It's a different entity. In this, chronic myeloid leukemia and polycythemia vera is the important one. Sometimes the classification of myeloproliferative neoplasms can be asked. Then you can just write down these things. It's a 3-mark. Most probably it can be a 3-mark question. So chronic myeloid leukemia, polycythemia vera, essential thrombocythemia, primary myelofibrosis, chronic neutrophilic leukemia, and CNL not otherwise categorized, mastocytosis, MPNs, unclassified. These are the classification. So the most important one is the chronic myeloid leukemia. So CML can be asked for an essay. So it's a most common leukemia in India, and the Philadelphia chromosome is the major thing to focus on. BCR-ABL fusion gene and translocation of 922 has to be mentioned, and it is having 3 phases: chronic, which having a blast less than 10%, accelerated having a blast percentage between 10 to 19, and blast crisis having more than 20% of the blast. Then neutrophilic leukocytosis with all stages of cells, eosinophilia, basophilia, and lab score. So here the chronic myeloid leukemia is a question for 5 marks or an essay, and this can be asked. This Philadelphia chromosome can be asked for 3 marks. This eosinophilia can be asked for 3 marks. Basophilia can be asked for 3 marks. Lab scoring can be asked for 3 marks. So there is one more thing, that is leukemoid reaction, which closely related to or closely resembles with chronic myeloid leukemia. So how will you differentiate between both things? So there will be an increased lab score or the NAB score, leukocyte alkaline phosphatase or neutrophil alkaline phosphatase for the same score. So the here we are seeing the lab score is 0 to 200, sorry, 0 to 20 for in CML case, but in a normal it is 40 to 400. So it will be having a higher end of these things. And there will not be basophilia and eosinophilia seen in, like we seen in CML, and there is an absence of BCR-ABL translocation. This leukemoid reaction is a question for 3 or a 5 mark question. Most probably it will be coming as for 3 marks. And the next one is multiple myeloma. So multiple myeloma is a neoplastic plasma cell dyscrasia. So clinical, it can be asked for a 5 mark. So if it is asking for 5 marks, you just remember to write the CRAP, that is a Pentad. There will be a hypercalcemia, renal insufficiency, anemia, and bone lesion with a monoclonal protein in serum, urine, or both. And the diagnosis part, hematological, the smear itself seen as a blue color due to paraproteins. Then the plasma cells in the blood and bone marrow, there will be an increase in ESR. So this time there is a chance of getting ESR in 3 mark question. Rouleau formation, pancytopenia and anemia, and other things like immunophenotyping with flow cytometry, cytogenetics, electrophoresis and immunofixation, and BJ protein. Bence-Jones proteins can be asked because you have a part in the clinical pathology aspects also you have this thing. So this can be clubbed and asked. Identification of blood parasites. So this is you need to mention you don't need to mention actually the thin and thick smear preparations, but for this actually the examination is, you can just mention it in a 1 or 2 sentence, and you can just start like thin and thick smear examination. What are the findings? In malaria, you can write the morphology of each falciparum, vivax, ovale, and all those things which you have seen in microscopy. And other techniques, fluorescent microscopy, quantitative Buffy coat method, these things. Actually, these are the microscopic method, and one non-microscopic method, that is the rapid diagnostic test, the card test. Then for microfilaria, wet preparation, concentrated methods, filtration method, QBC and microhematocrit method, lysed capillary blood, these things can be written. Then trypanosomes, wet preparations, thick blood films, or the Shanger aspirate, concentration method, that is QBC, that is quantitative Buffy coat preparation, and the capillary tube method. This is actually a this is a kind of capillary tube method, in which the microhematocrit method. So microhematocrit method, where you can see organisms in the junction between the Buffy coat and the plasma. This is the plasma Buffy coat interface where you can see the organism. So this is under microscope only you can see that. So the next one is the LD bodies, Buffy coat preparation, and babesiosis. Babesiosis also having the thin smear method only, thin smear preparations. So among these, what are the points you need to write? So you can just, for the identification of blood parasites, you can just start the started like with the organisms. What are the organisms that is possibly seen in the major organism possibly seen in the blood or the blood parasites? Then the different methods for each parasite. So this can be asked for a 5 mark, or this can be asked along with the ideal smear and the smear preparation as an essay question also. So the next one is the bone marrow transplantation. Mainly the indications for, so this is a direct question. It seems so it can become as a direct question as 5 mark or 3 mark. So the indication you can mention, the pre-test done before transplantation can be listed, and HLA typing, a brief note on the HLA typing, and bone marrow aspiration. That actually in that aspirate only we are using the HLA typing. The next one is LE cells. LE cells are seen in autoimmune disorders like systemic lupus erythematosus, and this is to detect the anti-nuclear antibody based on the reaction between patient's autoantibodies and nuclear antigens with subsequent phagocytosis by neutrophils. So the pink purple mass, it is appear as a pink purple mass in neutrophils. The preparation, so this can be asked for a 5 mark or a 3 mark question. So you need to write the principle behind that, and the procedure, like you will collect the blood, 5 ml of blood in a conical flask, defibrillate it, or just incubate it with along with the rod, kept it in. So that thing you need to just briefly describe, and you can write. It can be a 5 mark or a 3 mark question. And if it's just an LE cell demonstration, then the immunological tests are also using. So you can just mention it in that. And the next one is the hemostasis. So in that you need to cover up all these coagulation. What are the coagulation factors? Then the mechanism of coagulation, that is mainly the pathways of coagulation and the coagulation disorders. So the common coagulation disorder. So here the coagulation factors can be asked for a 3 marks or a 3 marks question, and the mechanism of coagulation, that is the pathway, can be asked as such. Both the intrinsic and extrinsic pathway can be asked for a 3 or for 5 mark question, or altogether it can be asked as an essay. And the coagulation disorder, so we are moving on to the coagulation disorders. So it can be classified as inherited or acquired. Inherited is hemophilia A, B, and von Willebrand disease, and acquired is disseminated intravascular coagulation and vitamin K deficiency, liver disease, etc. So the clot screen. So how will you screen the disease? So the platelet count is a must, prerequisite, and BT, bleeding time, is a prerequisite for any bleeding diathesis. Clotting time can also be asked. So BT, CTs can be asked as a 3 mark question. And the clot screen, mainly the PT, the prothrombin time, that is mainly for factor 2, 5, 7, and 10, and for an antibody, anticoagulant therapy warfarin, and it represents the extrinsic. The PT represents the extrinsic, or it finds the extrinsic pathway, and APTT is for the intrinsic pathway, that it involves factor 1, 2, 5, 8, 9, and 10, and it is mainly for heparin therapy, heparin anticoagulant therapy monitoring. Then and the next one is the TT, that is the thrombin time. These three can be asked together for a 5 mark question or along with the essay, and its methods can be asked separately for 3 marks, and the normal range has to be. So if PT is asked, methods has to be written, and its normal range, and the PTINR is a 3 mark question as well. Then in hemophilia A, it can be hemophilia can be asked for 5 mark or 3 mark. So its laboratory diagnosis has to be, or the laboratory parameters can be asked. So BT will be normal, CT is prolonged, PT is normal, but APTT is prolonged. And the correction studies can be mentioned, and the factor assay can also be mentioned. Then DIC, that is disseminated intravascular coagulation. It is due to the activation of extrinsic or intrinsic or the both pathways produce multiple fibrin clots in small blood vessels. So there will be a thrombocytopenia due to thrombocytopenia is the reduced number of platelets in the peripheral blood. So all the clots will taken up all the platelets for the clotting. So the platelets will be go down, and PT and APTT is increased due to the increased. FDP is positive, that is the fibrin degradation product. D dimer is positive, and fibrinogen level is decreased. This is used for this clot. So in this DIC as such a question for 5 marks or 3 marks, then fibrin degradation product can be asked for 3 marks. Then the next one is the platelet function disorders. This can also be classified into inherited and acquired. Inherited is a defect in platelet membrane, that is Bernard-Solier syndrome and Glanzmann thrombocythemia. Then another one is the von Willebrand disease and storage organelle deficiencies, that gray platelet syndrome and Chidia-Higashi storage full disorders are all those things. And acquired ones are dysproteinemia, uremia, and these are due to these things. Acquired platelet disorder is due to dysproteinemia, uremia, MPA, and MDS, etc. So this can be asked for just to list out the platelet disorders can be asked for 3 marks. And the platelet function test is a 5 mark or 3 mark question. So the main thing is platelet function is the platelet aggregometry, what we are doing. So for this, we need a platelet-rich plasma or PRP. In that, platelet is more. So it's a platelet concentrate. So this platelet concentrate, in this we will add some agonist. So that way, agonists are nothing but that will enhance or increase the aggregation of platelets. So these are ADP, collagen, ristocetin are some of the agonists which we are adding. So this is a platelet-rich plasma where the light transmission is poor because of evenly distributed platelets in this plasma. So once you are added an agonist, it will start aggregating. So it will aggregate and finally get settled in the bottom. So the light transmission is increased. So this is detected. So this is one of the method, and you can mention the von Willebrand factor antigen assay, RICOF, or the Ristocetin. It is a typographical error. Ristocetin cofactor assay. So this is the interpretation, or this is how it will be there in all these. At least these 3 you need to know. Then another topic is the automation in hematology. So the principles, the major principles you need to mention is electronic impedance, optical light scatter, and other small things are VCS technology, flow cytometry, fluorescence staining, and the MAPS, multi-angle polarized thing also. So this is the one of the composite of what is the principles behind each the thing. So this can be asked for a 5 mark question, or along with a 10 mark, along with the essay also, maybe a splitted essay. So the principles behind RBC platelet are hydrodynamic focusing and DC detection, and here the colorimetric detection, that is the SLS method. For WBC, it's a flow cytometry, that in flow cytometry you can write the optical scatter property. So now we can, these are the possible questions which we already discussed along with that. Although I would like to show you some previous questions, only the essay questions I'm showing. So this is from 2012 onwards. So just see the thing. So if they're asking leukemia, the thing is define leukemia, classify according to FAB. So there is a classification. So its mark is 3, and the blood picture for acute myelomonocytic leukemia. then the cytochemistry. So these three are more important: definition, classification, and cytochemistry. Then coming on to the next one, that is the here they ask for the definition and the classification of hemolytic anemia. In next year, they ask for define and classify anemia. Again, this is for the various coagulation tests and methodologies. Three basic coagulation tests. Basic coagulation tests are, if they are asking only three basic coagulation tests, then you can just mention BTCT, but they are not. The coagulation screen will, or the clot screen will contain PT, APTT, and TT. That has to become at this point. And enumerate coagulation disorders. Just mention those, enlist those coagulation disorders, and or if you can just make a column or just classify them: acquired and inherited. Then diagnosis of most of the describe briefly the diagnosis of the most common hereditary coagulation disorder. The most common hereditary coagulation disorder is hemophilia A. So that also can be done. The next one, again, define and classify anemia. It is in the next question paper. So here also the peripheral smear and bone marrow findings in megaloblastic anemia. So megaloblastic anemia is asked here. So hemolytic anemia asked, megaloblastic anemia. Then the next question, here the other essay is from the clinical pathology part, so I didn't put in here. So the next one is define and classify leukemia, discuss the lab diagnosis of chronic myeloid leukemia. So the chronic myeloid leukemia, so here you can write define and classification of leukemia can be done based on the neoplasticity of myeloid, all these things. So since they didn't ask specifically for FAB or kind, you can just classify based on the onset. Two classifications you will have, having onset, that is acute and chronic, or based on the lineage, myeloid lineage and the lymphoid lineage. That can be, because since it's a 4-mark question, you can write both the classifications here and the lab diagnosis of chronic myeloid leukemia. Then here also classification, everywhere they are asked for a definition and the classification of anemia. Then the deficiency anemia, then define the next question paper also, define anemia, classify based on etiology. This is kind of specific here, classification based on etiology. So you don't need to write the morphological classification here, but here you need to write the morphology classification as well. Here also define and classify leukemia, not specified which classification. So you don't need to write the, actually FAB classification is for the acute leukemia classification. So if they are just asking you to write the classify leukemia, so you can just write the lineage classification, and that is the myeloid lineage neoplasms and the lymphoid lineage neoplasms. Then here also chronic myeloid leukemia only asked. Then classify anemia, again anemia question. Classify, describe the lab diagnosis on Marrow. This is again for the megaloblastic anemia. Then define thrombocytopenia. This is quite vague, but you need to know the thrombocytopenia. What is thrombocytopenia? And enumerate the causes of thrombocytopenia. There are some causes. Then the describe the peripheral smear and the bone marrow findings in idiopathic. So ITP you can just read about ITP and just the findings will be written. So it's a so in these composite questions you know how to write actually. So 2 marks for this. It is 2-mark question. So you can write only 1 or 2. If you know 2, better you write the 2 things. So no need to explain so many things for 2-mark questions. But then the next one is here also anemia. Here leukemia is leukemia, classify acute leukemia. So this classification of acute leukemia must be of FAB classification, or if you know the WHO, write the WHO, or at least the FAB classification has to be written here. Then these are kind of specific. Classify nutritional anemias, only the nutritional anemias. So you can just list out the nutritional anemias, then describe the lab diagnosis of IDA and the blood picture also. So in this here also, chronic leukemias they have asked, mainly emphasis for chronic myeloid leukemia. This is chronic leukemias are like chronic CML and CLL is there. So that part. Then define and classify hemolytic anemia. That hemolytic anemia classification you need to add here. Then define anemia, list laboratory investigations in anemia. See, these three question papers, there is no, like, the mark distribution is not given. So you most probably you will get a 1 mark here and list the laboratory investigation in anemia, maybe 4 mark. Describe the blood picture in macrocytic anemia, maybe 3 mark. So 5 and maybe a 5 mark question, 5 mark. And see, in these two, they are asked for anticoagulants. So there are some miscellaneous questions that I will tell you in the end of this thing. And so anticoagulants, list of 5 commonly used anticoagulants, you see, and write their mode of actions and uses. Then again, anemia, define anemia, classification of anemia. So more or less, the questions are coming like this only. So mostly you can read that you need to know the definition and classification. Then some specific questions. Then here the preparation of good quality from the peripheral smear aspect, one question has come. So why? So miscellaneous questions are like they were not be there in your syllabus as such. അതായത് സിലബസിൽ കറക്റ്റ് ആയിട്ട് കൊടുത്തിട്ടില്ലാത്ത കുറച്ച് ക്വസ്റ്റ്യൻസ്, കൃത്യമായിട്ട് സിലബസിൽ ഇത് പഠിക്കണമെന്ന് പറഞ്ഞിട്ടുണ്ടാവില്ല. അങ്ങനെയുള്ള കുറച്ച് സാധനങ്ങളാണ് ഫീലിയാസ് ആൻഡ് പീനിയാസ്. ന്യൂട്രോഫീലിയ, ബേസോഫീലിയ, ഈസ്നോഫീലിയ, ദെൻ സൈറ്റോപീനിയാസ്, അതേപോലെ പാൻസൈറ്റോപീനിയ. ഇതിന്റെ ഒക്കെ ഒരു 3 മാർക്ക് ക്വസ്റ്റ്യൻസ് മോസ്റ്റ്ലി ഉണ്ടാവാറുണ്ട്. ദെൻ ESR ക്യാൻ ബി ആസ്ഡ്. ESR infectious mononucleosis ESR ഒരു ഫാക്ടറാണ്. സോ ESR can be asked for 3 marks. Then hematocrit can be asked for 3 marks. Then anticoagulants can be asked for 3 marks. Even it is asked for asked in a essay also. Actually, anticoagulants are in the first year, but since you are studying the coagulation, you need to know the anticoagulants too. That is the idea behind that. So that's all. And there are other miscellaneous questions that I have seen in the previous question papers are vacuodental tubes can be asked, myelopoiesis can be asked for 3 or 5 marks. So these are the main things asked in the old thing. So A, C, all those things. Or if you have any questions, you can ask.
ഇനി ഡൗട്ട്സ് ഉണ്ടെങ്കിൽ ചോദിക്കാനുള്ള ടൈമാണ്.
So I think there is no questions. So thank you for listening, and plus Samtinum, and thank you for Samt for inviting me for this session, and all the best for all the exam attendees. Thank you.
Okay.
Thank you, sir.
Thank you, sir.
നമുക്കിവിടെ ഈ സെഷൻ ഇവിടെ വൈൻഡപ്പ് ചെയ്യാം. ഏറെ തിരക്കുകൾ മാറ്റി വെച്ച് നമുക്ക് വേണ്ടി സമയം കണ്ടെത്തിയിട്ടാണ് ശ്രീരാഗ് സാർ നമ്മളോട് ക്ലാസ് എടുത്തത്, അല്ലെങ്കിൽ നമുക്ക് വേണ്ടി ക്ലാസ് എടുത്തത്. വളരെ എഫക്റ്റീവ് ആയിട്ടാണ് ക്ലാസ് വന്നത്. കാരണം നമുക്കറിയാം, ഒരു ദീർഘസമയം കൊണ്ട് എടുക്കേണ്ട ടോപ്പിക്കിനെയാണ് ഒരു ക്യാപ്സ്യൂൾ രൂപത്തിലേക്ക് കൺസൈസ് ചെയ്ത് ചുരുങ്ങിയ സമയത്തിൽ നമുക്ക് പറഞ്ഞു തരുന്നത്. അപ്പൊ അതിന്റെ പിന്നിൽ ഒരുപാട് എഫേർട്ട് നമുക്ക് എടുക്കുന്ന അധ്യാപകർ എടുക്കുന്നുണ്ട്. അവർ എഫേർട്ടിനൊക്കെ നമ്മൾ മാനിക്കുന്നു. ആ ക്ലാസ് എടുത്ത